Hello, new members of the EBAC Auxiliary. I'm really happy to be here with you today virtually to give you a little bit of background on EBAC and the work that we're doing. Normally, I would be giving you guys program tours and introducing you to some of the work that we do in person, but since that's not feasible, I'm going to try to do it virtually here. So bear with me. If you think back to 1952 when EBAC was begun, there weren't a lot of options for kids that had emotional and behavioral issues. Either parents institutionalized them or kept them home. And there was a group of families in Berkeley who decided that that wasn't enough for their kids. So they got together with some psychiatrists from Children's Hospital and researched and found a program in use in the East Coast that they brought here to the Bay Area. So from the 1950s through the 1980s, EBAC was simply one program with about 18 kids, elementary school age kids. It was a year-round school for kids who just wouldn't fit into a mainstream classroom. The intent was to address some of the issues that they had so that they eventually could transition into a mainstream classroom. So come the 80s into probably late 90s, we had a period of extreme growth, had a very young executive director who really saw the opportunity to leverage our expertise and merged with a lot of other small nonprofits who were working with vulnerable populations for kids. And that really set the stage for where we are today. So if you fast forward to 2020, EBAC now invests about $16 million a year in kids and families in the Bay Area. We do direct service exclusively here in Alameda County. There's lots of needs, so we haven't felt the need to expand beyond that from our direct service. We have over 200 staff. And we affect the lives of 14,000 kids and families a year, with 4,000 of those being very intensive with pretty significant interventions and recovery services. The common thread through all of our programming is trauma. If you have heard about the Adverse Childhood Experiences Study, the ACEs study, then pardon my redundancy here, but Kaiser and the Centers for Disease Control conducted a study of adults and asked these adults, 30,000 adults, on a scale of 1 to 5, how many of you had experienced one of these 10 childhood traumatic experiences? And those could be like sexual abuse, physical abuse, emotional abuse, separation from a parent, whether through divorce, incarceration, death, parental substance abuse, or mental health issues. And what they did is they correlated that data with physical health outcomes in adults. So the larger the number of adverse childhood experiences, or ACEs, that an adult had, the higher their risk and higher their incidence of many physical health issues like heart attack or heart disease and pulmonary disease and hypertension. So, you would expect that childhood adversity and traumatic experiences would increase things like mental health issues, depression, suicide, those kinds of things. But the ACEs study correlated physical health. So that was kind of a revolutionary finding in the children's behavioral health and children's health world, in that we have to spend a lot more time and providing treatment and interventions for kids as they experience trauma. So that really is the cornerstone of EBAC, and our mission is that we are to improve the well-being of children, youth, and families by reducing the incidence of trauma and the impact of trauma and social inequities. So we do this through 4 separate divisions, categories of programming. The first is our school-based behavioral health, where we actually have therapists in about 42 schools in 7 school districts in Alameda County. So these are master's level marriage and family therapists or clinical social workers who are embedded in the schools, and for all intents and purposes, the kids and families think they work at the school and not EBAC. And they provide pull-out therapy to mainstream kids in mainstream classrooms in under-resourced schools throughout the county. All these kids are Medi-Cal eligible, and so they're in their lower socioeconomic communities that have lots of stress and trauma in the family dynamic. And then we have our intensive behavioral health division. And we serve kids there that are already showing the impact of exposure, long-term chronic exposure to trauma. We serve kids ages 2 to 19 throughout this program. So these are kids that enter our therapeutic nursery school. It's a school near Children's Hospital that can serve up to 20 kids, age 2 through 5, who are already demonstrating challenges in behavior and emotion that makes them not really be successful in a traditional like Head Start program, preschool program. So our therapists and teachers and aides work with them to kind of intercede and bring them back into a developmentally appropriate path, working with the families as well. We also have students that we support in 7 schools in Oakland and the city of Alameda who are special education students. So they're already been identified as having their educational success be impacted already by a mental health disorder. And so we work with those kids both in the classroom with behavioral coaches and therapists to intercede and work with them on the issues that are limiting their ability to access fully their education. And then we also have the third component in our intensive behavioral health is our youth empowerment services. And we are working there with basically any child age 8 to 19 in the city of Oakland that is at risk of entering the juvenile justice system. So we're trying to catch kids before they make a grievous error and end up in juvenile hall. So these are kids that are chronically truant, starting gang affiliation, those kinds of things. So these referrals come to us from any number of places, and we have case managers and clinician therapists who work with the child or youth and the family to figure out what's missing, what's needed, what kind of supports the child needs to get them back attending school regularly. And primarily it's giving this child hope and a goal for a better life. Our third division is our Family and Community Wellness Division, and this really is wraparound services to support families and build resilience within the parents so that they can mitigate the impact of the trauma, whether that's trauma from poverty, trauma from homelessness, trauma from immigration issues, trauma from substance abuse, incarceration, whatever the issues might be around the family dynamic. So we have 5 family resource centers. Many of you already heard the Hawthorne Family Resource Center, which the auxiliary supports a lot. The Central Family Resource Center, which also the auxiliary supports a lot, which is our partner supporting the Oakland Unified School Districts. We also have one in San Leandro that partners with the school district there, in Hayward, which partners with the school district in Hayward, and our Fremont Family Resource Center, which has a staff of 8 people who speak 9 languages to be able to really meet the needs of the kind of mini United Nation immigrant population that makes up Fremont. And those services at our Family Resource Center are really in 3 areas: application assistance for public benefits, whether that's food services for CalFresh, Medi-Cal applications, CalWorks for jobs, whatever that might be. We provide case management for families that have high needs or are in crisis, so we can kind of make sure that they get through the situations that they're currently in and come out the other side intact and healthy. And then we do parent education, including some early childhood programming at both our Hawthorne Family Resource Center and the Central Family Resource Center. Also part of this division is our grief and loss services. So Circle of Care is the name of the program. It's one of the only EPAC programs that's open to anybody in the entire community. You don't have to be affiliated with a school or a school district to avail yourselves of these services. And it's really to support families that have children where there's been a loss, whether that's a death of a parent, a sibling, or a close grandparent. So this program's been with us for over 30 years and really provides support, peer support, to families who are experiencing something that they never expected to have to be going through. We also then have a one school-based health center that we manage in conjunction with an actual medical provider at Frick Academy in East Oakland. So that gives us an opportunity to serve the medical needs, dental needs, and mental health needs of the staff, the school, as well as the community. And then our fourth division is the only one that's not direct service related. Our Trauma Transformed initiative was created in 2015 to lead a 7 Bay Area county government collaboration to improve the way that these government services, these government agencies respond to and support families who are impacted by trauma. So think social services, foster care, behavioral health, school districts, probation departments, juvenile justice, all of the government agencies that are charged with supporting kids and families. We created this collaborative funded by a large 4-year federal grant to really help them understand trauma, what trauma does to an individual, what trauma does to a family, and what trauma does to organizations, and help them reassess kind of the way they operate and the policies and procedures that they have that may actually perpetuate trauma as opposed to reduce trauma for these families that they're trying to serve. So the training infrastructure and the policy and practice change model that Trauma Transform created was very, very successful, very well embraced here in the Bay Area, and is out and actually now a national model. We're doing technical assistance for the New York public health nurses, who are obviously very busy right now. We've been working in Seattle, we've done work in Southern California. So it's very excited that our Trauma Transformed, we've been able to leverage EBAC's years of understanding how trauma impacts individuals and families to be able to really create systems change for in an organizational way. So there you have it. That's the EBAC basics and a lot to absorb. Email me at jwest@ebac.org, and I'd be happy to schedule some personal time with you and explore your needs and desires to work with the organization. So welcome aboard, and I hope to talk to you soon. Bye.